How's it going, runners? It's Justin, your average running PT, and I want to teach you guys how to fix a calf strain or any other soft tissue injury based on how I fixed mine 3 months ago. So follow along, let's take a look. So here's the truth. Soft tissue injuries, they're really frustrating. However, they can be extremely easy to treat if you know a few simple steps. So just as a disclosure, I want to make sure that you know that not all health information is suitable for every single person. This video should not replace an evaluation and treatment by a qualified healthcare provider. I want to make sure that you guys know that. Now, with the disclosures out of the way, let's get into some of these very basic things. So for dealing with a calf strain or any other soft tissue injury, it requires 2 steps. And we're going to go deeper into these 2 steps, but basically what they are, you have to evaluate it honestly and thoroughly. And secondly, you have to treat it with the respect to tissue healing. You have to make sure that the treatment that you are doing is not making the problem worse, but that it is actually facilitating healing of the tissue that is affected. And this is similar for many soft tissue injuries. So you can consider a quad strain, a hamstring strain, a tendon problem, plantar fasciitis. All of these types of problems, they're all soft tissue injuries. And these types of soft tissue injuries, they all respond very similarly. Depending on the type of structure or what you're doing, it might take longer for some, it might be shorter for some. So let's take a look. I'm going to show you how I went through the process of evaluation and treatment for my calf strain so that you can get an understanding of what the process looks like and how you might be able to apply this to any type of soft tissue or calf injury that you may be dealing with. Alright, so here's how we're going to break this down. As I mentioned, there's 2 steps to dealing with a calf strain or any other soft tissue injury. That is an evaluation and a treatment time, okay? So whenever we're evaluating for an injury, you're looking for 2 things. You're looking for, number 1, what's the severity of this injury right now? So you're looking for, how bad is it? How bad is this problem? And for myself, whenever I had my own calf strain, I could tell really quickly that it was not extremely severe, meaning it was a grade 1 simple calf muscle belly injury, okay? So you're looking for how can you grade this injury, grade 1, 2, 3, in order to come up with some sort of a plan, okay? Remember, the plan comes down here. That's step 1. Figure out what's the severity of the injury and where is the injury actually occurring. Is it in what tissue is it occurring? Because that's going to tell you the severity, and where the tissue problem is located is going to tell you just how long this is going to take for you to overcome it. Okay, so I knew it was in the muscle belly of my calf, meaning it was in the muscle, not in a tendon. And I knew that it was very light, so it was a grade 1 muscle belly strain. Now, what are you looking for next? Next thing you have to figure out within the evaluation is what was the actual cause of the problem. So now you're looking at, and forgive the marker, it's not extremely bright, but number 1, severity. Number 2, what's the actual cause of the problem? Okay, and I want to break this down. There's a few different things that we can attribute to these injuries occurring. Number 1, mechanics. How are you actually running, and how is it affecting the tissues around? Okay, so is your running form, are you running up on your toes a lot and that's putting a lot of stress on your calves? Are you running in such a way that you're not very well balanced and one side is working harder than the other side? This is really important to nail down. What are your mechanics and how is it affecting the overuse of particular structures? Number 2, footwear. There's a lot of talk out there about footwear. This is extremely controversial. So people say run in minimal shoes. People say run in max cushion shoes. People say run in very rigid and highly supportive shoes. There's all these different sides to this argument. So the truth is, footwear can affect the way that your foot, your calf, your leg, your knee, your hip, your back, all of those operate, but it can be different for every single person. So you want to make sure that you are addressing the footwear issue, but you want to make sure that you're addressing that for the person that you're looking at. So it may be different for you than it is for me. Now, thirdly, what is your mileage? Are you increasing miles rapidly? Are you doing more miles on trails? Are you doing, what is your mileage actually looking like right now? And did you make a big jump in mileage all of a sudden? Really important to consider, because you have to respect the ability of the body to adapt to increased training loads. If you don't do that, then you're putting yourself at risk for injury. All right, and the final thing is, and this kind of goes along with mileage, but it's a little bit different, and it's intensity. And I'm going to talk about two of these here that contributed to my own calf strain, because I think that it's really important to look at what somebody else did, and then you can kind of learn from that for yourself. So are you increasing your speed? Are you doing more hills? Are you doing more plyometric work? What kind of intensity are you putting on these specific structures that are now starting to break down or become overworked? So for myself, I know exactly what my problem was whenever I strained my calf. It was my footwear and my intensity. And I remember it was on one run. I ran a hard 1.5 miles just to kind of test myself. And I didn't really think about what I was actually wearing. I put on completely minimal shoes, and I went out and ran a really hard mile. And the combination of those two things led to my calf getting overworked. Now, fortunately, I caught it early, and I didn't try and push through it necessarily, so it only ended up being a grade 1. So that made it so that my treatment plan was going to be significantly shorter. Otherwise, it would have been much longer if I had just tried to push through. And that's an important lesson to understand, is that if you're starting to feel some kind of a tweak and it's actually changing the way that you run, or the pain is going above like a 4 out of 10 on a pain scale, then you know you need to back things down, okay? Now, as far as the treatment goes, here's what I did. I made sure that based on the tissue healing that I knew was going to need to take place, I made sure that I rested in order to allow for that to happen, okay? So, number 1 is rest. Now, I know that's like a sinful word in the running community. Nobody wants to take time off. Nobody wants to not get out there and do the activity that they love. But sometimes you have to respect what the body is telling you. And if you've overdone something, sometimes the only way to make it recover is to rest. Now, I'm going to show you that that doesn't mean I took a complete rest and did absolutely zero, sat on the couch and ate potato chips. Not at all. Okay, so I want to make sure that I'm very, very clear about that. Rest means rest from the specific things that are going to cause it to get worse. Okay, that means running. I did have to take some time off of running. Now, I know with a grade 1 calf strain that that's going to take me about 3 weeks in order to get to a point where I can start to run again. All right, so I knew that I needed to rest, and when I say rest, I mean active rest, for a period of about 3 weeks. Now, it will be different if it's a tendon problem. It'll be different if it's a grade 2 or 3. Obviously, those are much more severe. It will take a lot longer to do to allow the problem to get better. Now, for myself, what did I do during this rest period that actually helped me facilitate the improvement of that calf strain. So number one, I definitely did strength work. Okay, and I'm not talking about just doing strength work for the things that were not affected. I'm talking about specifically for my calf. I made sure that whenever I was doing my, whenever I was resting, I was also doing things that were going to help facilitate and strengthen the calf muscle as it healed. So I was doing a lot of calf raises, starting with isometrics, progressing to eccentric loading, and then going to concentric and plyometric. Now those are some big words there. So what is isometric? Isometric basically means if you were to stand up on your toes and hold it there, that's an isometric contraction where you are not moving but you're contracting the muscle. That's the most gentle way that you can start to strengthen a muscle. Now, research has shown a lot that eccentric contraction, which is the lowering phase of a muscle contraction. So say you're up on your toes and then you slowly lower down to the floor. That is also being shown to be very, very effective in helping with a muscle strain. Same thing with tendons, same thing with many other structures. And then I moved on to concentric, increasing load over time. So putting weights in my hand and starting to increase that load. And then to plyometrics. This progression started and to finish progressed over the period of 3 weeks. So this rest period was 3 weeks, but as you can see, it's an active rest. Everything needed to be 100% pain-free. Okay, so 3 weeks for my calf strain, progressing from isometric to plyometric work, because running is a plyometric activity. You're bouncing from one leg to the next. So that's what I was progressing toward over that period of 3 weeks. Over that time, I was also doing a lot of manual therapy. Now this can be done on your own, where you kind of get your thumbs in there and you kind of work on the soft tissues. You can have a manual therapist do it, whether that's a massage therapist or a physical therapist. Or you can do self-treatment with foam rollers or lacrosse balls or things like that. What this is going to do is it's going to help facilitate blood flow into the area and help loosen up the surrounding structures so that this area can focus on strictly healing. Okay, so this is how I kind of progressed through my evaluation and treatment, and then I started my progression back to running. And I made sure that as I started my progression back to running, I didn't start where I ended. I had ended at about 20 to 25 miles a week. So when I started back up, I think I started back at about 15 miles. So then you got your return to running. I started back at 15 miles and progressed over a period of 2 months to 30 plus miles. Okay, so it took me a little while to get back to where I was before. It took me about a month to get back to 25 miles, which is where I was before, and then another month of just slow progression up to the low 30s in my mileage. But this is the path. This is how you treat soft tissue injuries. You make sure that you give it the rest that it needs. You make sure that you're doing the strengthening that's required. Now that means you're also strengthening the surrounding structures. You can still do strength work for your hips, your quads, your core, all of that stuff if you're dealing with a calf strain. So make sure that you're not just sitting around doing nothing, and that you are actually doing the strength and the manual therapy and the return to running in the proper way so that you can be stronger when you come back from this injury. So that's it. That's how you fix a calf strain. The problem is a lot of people aren't patient enough and they want to get back to what they were doing as quickly as possible, but you have to make sure that you respect what the body is actually going to allow you to do. So if you guys like this type of material, go ahead and subscribe down below. Click the notification, because I want everybody to have the ability to treat themselves if they need to, even if they go and get some sort of evaluation to make sure that what they're doing is correct. but then they can kind of start to self-treat in such a way that it's not going to cause them to be re-injured. Now, if you have any questions about specific injuries, whether it's calf strains or any other soft tissue injury, or any other type of common runner problem, whether it's plantar fasciitis, or runner's knee, or hip bursitis, or Achilles tendonitis, things of that sort, shoot me a question in the comments. I would love to talk to you, and I would love to give advice on how to actually treat these problems. And if I see you guys posting those things in the comments, it'll definitely help me with future content and help me to know what kind of videos to make to help runners like yourselves to overcome very, very common injuries. So again, make sure you subscribe down below so that I can help you guys out in the future. As always, move with freedom.